Hello, my name is Sarah Jensen. I'm an internal medicine chief resident at UCLA, and today I'll be telling you about our study, Longitudinal Interventions Provided by a Palliative Care Specialist within an ALS Multidisciplinary Clinic, a cohort study. ALS is a chronic, progressive, and ultimately fatal neurodegenerative disease that impacts the quality of life of persons living with ALS. While primary palliative care, which is palliative care provided by a non-palliative care specialist, has been described and published in the literature, additional data are needed to better understand the role of specialty palliative care for persons with ALS. In our prior study published in Muscle and Nerve, we described the feasibility and utility of referring all persons with ALS to a PC specialist. We call this a universal referral method, compared to the traditional method of referral, which is based on specific clinical triggers. In that study, which was over a 1-year period, we found that 75% of patients were able to be seen, and that 94% of these patients discussed at least one advanced care topic or goals of care during their visit. This led us to ask next whether these patients continue to have ongoing PC needs beyond their first visit, and if so, whether to see the PC specialist moving forward. Today, I'll be sharing our longitudinal data. The objective of the study was to characterize longitudinal visits with the palliative care specialist for patients with ALS seen in a multidisciplinary clinic within a large academic hospital system. This was a retrospective cohort study of outpatient follow-up visits between January and December 2019. All patients were referred to palliative care physician unless they did not wish to be seen for personal preference or did not have a confirmed ALS diagnosis. Patients also required prior insurance authorization. These charts were reviewed manually by our team using the Epic EMR. Baseline characteristics were extracted. This included age, sex, mortality at the end of the study period, presence or absence of life-prolonging therapies, things like percutaneous endoscopic gastrostomy tubes, PEG tubes, non-invasive ventilation, and tracheostomy, an ALS functional rating scale revised. Clinical outcomes were extracted. These included patient symptoms, advanced care planning topics, goals of care topics, code status, and whether patients had advanced care planning documentation, either in the form of an actual advanced directive form or POLST. In total, 69 patients with a confirmed diagnosis of ALS were seen by this multidisciplinary team in the ALS clinic within the study period. Of these, 75% were seen by a palliative care specialist using the universal referral model. At their first multidisciplinary ALS clinic within the study period, 9.6%, or about 5 patients, were not seen by the palliative care physician. The reasons for this included insurance limitations and fatigue. On average, each patient had 1.8 visits with palliative care specialist over the study timeframe. The number of follow-up visits ranged from 1 to 6 visits. Please turn your attention to Figure 1 on the poster. 80% of the follow-up visits included a discussion of goals of care, 63% included a review of advanced directives, and 30% included a discussion of code status. We further delineated topics categorized as goals of care. This can be seen in Table 1. The most common subtopic referenced within goals of care was meaning and values, which was discussed during 45% of follow-up visits. The next common topic discussed was quality of life, coping with disease and diagnosis, as well as family concerns. Lastly, we found that these visits with palliative care specialists resulted in increased documentation of advanced care planning conversations, including requests for decision makers and preferences for the end of life. Patients who had documentation of these conversations increased from 27% to 73% following longitudinal palliative care. Our study suggests that persons with ALS have ongoing needs that may be addressed by a specialty palliative care provider. Persons with ALS could benefit from longitudinal follow-up with a PC specialist. Future studies are needed to understand the clinical impact and significance of these findings. I would like to thank Julia Hafer for her diligent hard work, Dr. Wiedau-Pazos as well for the entire ALS Multidisciplinary Clinic. And lastly, I would like to thank Dr. Mehta for her mentorship, dedication to myself and the project, and her never-ending support. Thank you so much.